Cynic supreme. All right, folks, I want to start on these dramatically slashed doctors' fees. Every day, the true cost of Obamacare becomes clear. Here, the doctors get squeezed performing the same services for bargain basement prices. But if they opt out of the plans, the cost to the patient is a tight pool of provider options. So much for keeping your doctor if you like him. I don't know. I fear the death of the medical profession. Let's ask our guests. Here now is Dr. Bill Grace, founder of Grace Oncology and assistant professor of clinical medicine at New York Medical College. Also with us tonight, Democratic strategist Chris Kofinas, Heather Higgins, the president and CEO of Independent Women's Voice, and CNBC contributor Jim Pethokoukis from the American Enterprise Institute. All right, Bill Grace, Dr. Grace, let me start with you. First of all, are they just pricing doctors out? Is this a deliberate strategy? These numbers are too small. $20 a visit or $20, it's crazy. This is absolutely crazy.
Well, they thought they had everything worked out on the front of this whole deal, Larry, and you know what a disaster that's turned out to be. But I don't think they had any idea what they were going to do on the back end. But no one thought we were going to get more money from this. We were all thinking that this was going to be, as if you remember, 2 months ago I said this was Medicaid plus, a slightly better reimbursement than Medicaid.
There is a long-term trend here, if I'm not mistaken, both for Medicare and Medicaid, to keep slicing and slicing and slicing down. Hospital reimbursements, doctor reimbursements. This is part of that trend. Why? Why won't they reward doctors?
Basically, they compare the price of physicians in Europe to the United States, where we do get more money. However, they get free medical education in Europe. They don't have the tort issues we have here with unreasonable medical malpractice suits that increase the cost tremendously. And the training is much longer here. It takes us an additional 8 years of cost and very poor incomes before you actually go out and start a practice.
How much is this going to knock down the pool of doctors? Let's say this stuff goes through. How much will this take down the pool of doctors?
We're already 15,000 doctors shy of primary care specialists that we need. And this will eliminate many, because I think a lot of will go into concierge practices, realizing that quality of life is better than maybe how much they make. And there will be other people who just say, I'm going to retire early.
Now, one last thing, I'm going to get my panel on this too, but employer-based plans pay a little better. Is that true? Is that fair, employer-based plans?
They do. They pay a little bit better, oftentimes a little better than Medicare, and sometimes a little worse.
All right, we're going to go. Heather Higgins, what do you make of this? What's going on here?
Nothing that one couldn't foresee, unfortunately. The problem of physician shortage was already predicted to be acute, and this is going to make it worse. This is just one more form of redistribution, and it is one more example of the antithesis of that JFK wonderful quotation which you had at the beginning. He understood the paradoxes that make economies and markets work. The people who are in government right now think that they can just issue things by fiat. Poof, we're going to have a website that works, or poof, we're going to slash costs, and they think it's going to happen without secondary and tertiary consequences. But those of us who live in the real world know there are very, very painful real consequences to these changes.
Jimmy Pethokoukis, is this, who's the real culprit here? Because I think somewhere in there the insurance companies are shaving down costs, right? Is Obamacare forcing the insurance companies to do that, or are the insurance companies just making a conscious decision that cost cutting can come out of doctors' hides?
Don't forget that Obamacare came about as part of a sweetheart deal between large insurance companies and the government. I mean, if you look at, for example, whether you want to call it a tax or a penalty that people will pay for not being adequately covered under the definitions of this administration, that money goes to the insurers, to the insurance companies that are going on the exchanges. I mean, if you want to talk about a wealth transfer that is seriously unjustified.
I'm not going to feel tremendously sorry either for the insurance companies. I'm also not in the let's keep doctors' salaries high business. Listen, I think we should have a lot more foreign doctors. I think you could have a lot of people, nurse practitioners, doing a lot more. I think that'll help sop up some of that demand for doctors. But listen, the president could have never have sold this plan if he would have sold it. You know what? This is Medicaid plus. I don't know, maybe it's Medicaid minus. It would have never gotten through. Between doctors leaving the profession, you're going to have these narrow networks, which could end up being, by the way, a ton of lawsuits from people who don't think they're getting proper health care because, A, they can't go to the great local community hospital, and it's too far away, and they can't get the preferred service. So, and then you're going to have potentially huge rate hikes at the end of this year. The thing, it's not looking very strong right now.
But what are you going to get? Bill Grace, just one point on this. You do have, as Jimmy, I think, was referring to, you have these storefront medical places. I mean, they're putting them up in Walmart, for example, and other places. What's that going to do to this whole story?
Well, that'll drive prices down for sure. And there are going to be, but they're going to appeal largely to people who are very poor and people who have very poor reimbursement. So those are the people who will be able to find their care there.
With all due respect, however, some of this stuff doesn't require doctors. Experienced nurses could do it. I mean, is that fair?
Yes, I do it in my own office. You know, flu shots and things like that are not given by me. They're given by my nurses.
And you're going to get a lot more telemedicine as well. Listen, these are things we should want. I mean, these aren't bad things to have people, nurse practitioners, medical assistants doing more of what they can. Listen, there's a lot of crony capitalism where you have doctors trying to prevent that from happening.
Chris Kafinas, let me just ask you, I know you're a defender of Obamacare. What do you all have against doctors? That's my first question. What do you have against doctors? And remember, these guys and gals, they got, what, $300,000–400,000 in debt to pay off because they became doctors? Chris, why are you trying to destroy the doctoral profession?
I'm not trying to destroy the doctor profession at all, but thank you for that loaded question. I mean, listen, I think Jim made a lot of valid points. I mean, the logic here is obviously to try to bend the cost curve. I mean, if you're going to do that, you're going to have to cut payments to some degree. This is, by the way, a phenomenon that's been going on for years. This tension between the insurance companies and doctors and how much they pay doctors. So that's nothing new. Obamacare's probably added some new pressure to that. There's no question. I mean, listen, I think one of the things that where the actual doctor makes a really good point, and who are in the medical profession, I think are very valid, is they come out of medical school with hundreds of thousands of dollars in debt. And they have to go into the residency programs where they're not really earning a significant amount of money, to say the least. Right. And that puts them in a hole. I respect that. I think that is something that we need to address.
All because we have to have socialized medicine, one-size-fits-all mandatory payment. That's all that is.
But remember,
socialized medicine means bad doctors. Come on. But remember, they're not going to get it. The pool of doctors is going to go down. But remember, the training of doctors is going to go down. You know what? Here's my thought. Here's my thought, Chris. Just came to me. I don't know why I didn't think of this earlier. Team Obama wants doctors to be like in the federal service, GS-14s or GS-16s. That's what they want.
As someone who was formerly in the government, I don't think that's true whatsoever.
I was in the government. I know what a GS-16 is, and I think doctors want more than GS-16. Heather, the really good doctors are going to go into concierge medicine. That's the deal.
You're going to get a very stratified, you're going to accentuate the difference between those who can afford quality care and those who can't, which you would think would be the antithesis of what anybody who's remotely progressive would want.
That was already the case.
It's going to be worse. It's going to be much worse. And anyone who understands economics knows that the only way you bend the cost curve downwards is to actually introduce some freedom of markets and get rid of some of the regulation which has kept the prices high.
Let's not pretend like the healthcare system was perfect before.
It wasn't. I am no defender of the healthcare system that was before, but the problem with Obamacare is it takes a broken system and it puts it on steroids rather than actually fixing it.
Jimmy Pentakougas, that's just the last one on this round. We're going to come back and talk some more. You know, the government starts messing with this stuff, Jimmy. The government starts setting quotas and price rationing and all the rest of it. You're going to get more class warfare, not less. More, right? Because you have the top tier going to go into concierge medicine. I confess, I'm part of a group. I go there, they give me the greatest services, I can do almost everything there, and if that doesn't work, they'll give me a nice room at the New York Presbyterian. But unfortunately, that's not the way it works for most people. I'm grateful to be able to have that, but that's not the way it works for most people.
I mean, what did the president say about the exchanges? He said the product is good. He didn't say this is going to be a lot like Medicaid. Good luck finding a doctor. It may not be the best doctor, and it may be an hour drive away. That is not a good product. And for people going into being herded into these exchanges, and you have other companies dumping their employees in exchanges, that's what they're getting, a not good product.
Right, you got it. All right. Many thanks, Dr. Bill Grace. We appreciate it. Jimmy, Heather, Chris, hang around. We've got a lot more to do on Obamacare tonight. And by the way, folks, don't forget the nuclear... Welcome back to the Color Report. We're broadcasting live from CNBC headquarters. All right, it was announced today that the deadline to enroll for coverage under Obamacare exchanges has been pushed back from December 15th to December 23rd. All right, despite still not fully functioning healthcare.gov, Americans will get an extra 8 whole days to sign up. But get this, next year Obamacare enrollees will have an extra month to sign up for 2015 coverage. Now, the White House says this gives insurance companies more time to determine rates. Maybe so. But critics say the White House doesn't want voters to see the premium prices before midterm elections. Let's ask our guests. Back with us, Chris Kofinas, Heather Higgins, and Jim Pethokoukis. I got to start with you, Chris. You know, fool me once, what's the phrase? People are going to see right through this. They're going to know the premiums are going up. I don't care what the due dates are.
I mean, listen, if this was done for political reasons, I'm not sure it's that smart, politically speaking.
Yeah.
I mean, at the end of the day, it's not like the Obamacare or the Affordable Care Act is not going to be an issue in the midterm elections. We already all know that. So if it's a question of moving it, a month or a few weeks past the election, I'm not sure it's going to make much of a difference. Either the program is starting to work and the website's fixed and people are seeing some positives, that they can clearly embrace by the middle of next year and the early part of next year, going to the summer or the fall, how you want to describe it, or not. And if it's not, then I don't care when the deadline is. It's going to be bad political consequences for Democrats. That's, I think, as simple as it is.
No, that's fair and honest. Heather, on this very point, I mean, I don't see what a week really does. You got all these Democrats in the Senate worried about re-election. They want to push it back many, many months. And for the life of me, I don't understand why the Obamacons don't do that. Why are they so stubborn? I mean, 1 week, what is that going to do? If the darn thing's not ready to go, it's not ready to go.
I would think that they would want to do the same thing because they want to seem competent and reasonable, and at the moment, they seem neither. They seem very dogmatic and ideologically rigid and determined to force everybody into something that they don't want to be in. I think Kaiser just came out with a poll that said that it was down to, 33% approval on this law? It's really, really turned. And people are seeing the real consequences and how they were, frankly, seriously misled about what was involved. And what's really sad here is that this is only the beginning. There is so much more to come. Nobody's yet talking about all those people with pre-existing conditions where their state-based high-risk pools are going to be closing after December, and they've got really not much place to go if these exchanges aren't working, and even when they get there, they will discover how expensive they are. You've got studies touting these wonderful subsidies, but the subsidies for many people will not begin to cover the massive increases in premiums that they're going to be facing to pay for a product that they don't want.
And they're not going to get any more money from Congress. That is for darn sure. No. Jim Pethokoukis, can I be a cynic about this?
Oh, please.
I want to link this back to the filibuster business that we had yesterday. Okay, so the filibuster's gone. Does that mean Kathleen Sebelius is gone? They can fire her and they have a filibuster-proof replacement for her, whereas previous to that, it would have been touch and go? Sebelius finished now? Is that one of the implications?
Well, what's interesting, because before, had he fired her, good luck getting anyone confirmed other than maybe Rick Santorum to be the head of HHS, right? And it also really plays in well with the whole IPAB. All right, remember that was called the original death panel. The group of bureaucrats who's going to decide what payments are to try to lower Medicare costs. Now it's going to make it easier for Obama to fill those positions. Now, previously, even if he had not been able to fill those positions, it would have fallen to who? Sebelius, to sort of be the one-woman IPAB. All right, so he couldn't fire her then, because then that would completely ruin the system, because then he couldn't get another HHS secretary. So it does give him a little bit more latitude if he wants to go that way.
If he wants to go there. Chris Kofinas, how long is Sebelius going to last? You see that? Well, I think we ran it again tonight. She's going out. She's in some place around the country. She's talking to somebody, and they're trying to dial up the system, and the system breaks down, like right while she's there. The system breaks down. Hey, Chris, you know, there's a limit to how many times per year. I believe this is it. Maybe I'm wrong. How many times can she tour around and go online and have the system break down in full view of all the cameras that are following her?
Well, I mean, if this website isn't humming by, you know, early December, to say the least, I think the pressure is going to grow pretty severe for the president to hold someone accountable, and I think, you know, Secretary Sebelius will be the top choice. I mean, my perspective, my perspective is when something like this happens, you got to send the American people a message, and nobody likes to be held accountable, but that's the job. You go into public service, I'm sorry, that is the job, and when you screw up, and, you know, you've got to hold someone accountable. And I think the president in this case, you know, should. You know, if I was the president, I would have fired her. I mean, I just would have.
Well, you know, the president has held somebody accountable, John Boehner.
Boehner?
He's held John Boehner accountable. He's held the Republicans accountable.
He's blaming Boehner.
He's already checked that box. He already held the Republicans accountable.
But I'll say this. I don't want Chris, I admire what you said was very honest. I think that the best politics here would have been to fire at least Sebelius, if not other people. I really agree with you that in terms of Obama's perspective, a firing would have looked really good. Should have happened a month ago.
Yeah, but just as a contrarian point of view, anybody else he brings in won't have an obligation to defend this mess the way she does. And whoever he brings in might very well be arguing for a much longer delay or a total scrapping or a back to the drawing board kind of a deal.
Maybe he'll pick Hillary Clinton. She has a lot of health care experience.
I got to get out of here. Maybe they'll put an out-of-work doctor running HHS, doctors that can't get paid.
Maybe you, Larry.
I think, I don't know, cabinet secretaries, what do they make, $150,000, $170,000? Anyway, I got to get out. Chris Kofinas, Heather Higgins, Jimmy Pethokoukis, thank you very much.
Thank you.
Now, we had another record close on Wall Street today.